All right, hello everyone. I hope everyone is doing fine. Let me do something real quick. All right. Hey, all right. I hope I want to thank you for joining us in this monthly session of our virtual dental health academy. Again, I want to thank you all for joining us for our virtual dental health academy. All right. We want to ask everybody that's watching on social media, if you're on Facebook, YouTube, or Twitter, if you can go ahead and share that post, and I would be extremely, extremely appreciative. If you're watching on Facebook, YouTube, or Twitter, do me a favor and go ahead and share that post, and I would be extremely appreciative. We want to thank you for joining us here this month with our virtual dental health academy. And the purpose of our ministry, anybody knows the vision of our ministry is to build upon the whole person by providing theologically sound biblical teaching, effective worship, commitment to family, and an emphasis on understanding personal purpose. And so it is always our goal to make sure that we provide ministry. And simply what ministry is meeting the needs of the people. And so that's why we offer different forms of health ministry. That's why we offer our financial wellness ministry, our mental health ministry, the work that we do in the community. We find out what the needs of our community are, and we offer ministry to meet the needs of the people. And especially if we're able to offer opportunities at no cost. And so we use the gifts that God has given us in our ministry, and we meet the needs of the people. And so with our dental health academy, we're blessed to have a dentist in our ministry that wants to give to the community and offer what he knows to the community. And so Dr. Scott makes himself available and and provides his expertise for to the community. And so one thing that I'm really grateful for, that tonight what we're going to do, Dr. Scott will have some conversations with us, but then what we'll do is he'll give an opportunity for those that are watching to ask the dentist any questions that we have. Before we go to a dental appointment, or if we're feeling something or whatever, to ask the dentist. And so he's made himself available. He's prepared, and we're looking forward to an amazing opportunity this evening. And so again, if you're watching on Facebook, YouTube, or Twitter, please go ahead and share the post. Would be extremely appreciative. And I'm going to place it in the hands of our coordinator of our Dental Health Academy, Dr. Curran Scott Sr.
Hey everybody, how y'all doing? Let me close. The sun's about to blind me here. I hope everybody's doing well. Pastor Ron, thank you for keeping everybody busy while I got situated here. How you doing tonight, Pastor?
Doing good. What about yourself?
Doing good. Happy to be here. Happy to share. I wanted to say real quick, before we get going, like Pastor said, really the goal tonight is just to just stimulate some thought and just kind of get people talking. You can stop me at any time and ask me any question. It's either I know it or I don't. So ask me the question. No, go please. Sorry. Ask me the question and we can move forward. Okay. So let's do. Okay, Pastor, can you make it so I can share my screen?
Definitely can. All right, you are good to go.
Okay. So last time we left off, I just want to do a quick recap of where we were last time. So last time we talked about periodontitis and gingivitis, and just some of the basic differences. We talked about toothpaste. We talked about a whole bunch of stuff. We talked about diabetes and some of the other systemic diseases that people suffer from, and just some conversations that you should be having with your physicians and your dentist when you come in contact with them, and just holding your healthcare professionals accountable and asking all the necessary questions and make them stop and talk to you. So those are some of the things that we talked about last time. And so just to go through this really quick, gingivitis. You can see here on these photos, you have healthy, mild, moderate, and severe over here. So just some things to keep in mind when you're brushing your teeth, what to look for. Um, things should things should be looking out. With African Americans, we have pigmentation in our gums, so our gums will be tend to be brown, which is okay. That doesn't mean that your gums are unhealthy. It's just we're black. So brown gums doesn't mean unhealthy. Swollen gums means unhealthy. So here are this is just some photos of moderate gingivitis, and you can see in that middle photo how when we stick that little instrument that everybody just likes when they come to the dental office, that little instrument we stick in your gums typically bleed for people who have gingivitis. So and also they bleed when you brush your teeth or when you floss. If you floss or brush and you notice that your gums are bleeding, that's a surefire sign that you have at the very least gingivitis, and you need to adjust your oral health care or get in contact with your dentist to get some help for that. Now, I will say gingivitis is completely reversible. So, it's not really something that can't be fixed. It's when you move from gingivitis to periodontitis is when you start to have problems. And then this picture on the far left with the purple, with the blue stuff on there that we use to stain the teeth so we can know where the plaque is. And so here you see the bleeding. And then here you see again severe gingivitis. You can look and see how swollen the gums are. The gums are so swollen. I'll go back. The gums are so swollen in between the teeth, and they bleed and they hurt, and it becomes more difficult to brush. It's hard for you to floss. You're having a lot of pain and sensitivity in your teeth. That's when you need to go to the dentist. And so here's some types of gingivitis that turn into ulcers. Then you see a lot of pus coming from them. Sometimes you might have a bad taste in your mouth. You might develop a fever. All kind of stuff can happen. If you see, like we talked about at the couples real talk last week about stress in our lives. A lot of times, these types of things come up when you have stress. So if you have or are currently going through a stressful situation, just take a moment and do your checks and balances and check to see what you got going on, okay? And then just some other puberty gingivitis for the young folks. Uh, pregnancy
Dr. Scott, I
You
think we
can
might
get
be
a
losing
lot
your
of
audio.
lesion hormone imbalance, just those are popping. And what it does is, can you hear me?
Okay, yeah, I think your audio
Can
is
you hear me
fading
now?
in and out.
Can you hear me now?
Yes.
Okay. And so this right here where these pink arrows are is just bone loss. And that's what happens under your gums around your tooth when you don't get your gingivitis treated. It turns into periodontitis, which is bone loss, and that's what you see. When we go in and open up your gums, that's what we see. And you can see a picture here on the upper right where the bone is nice and smooth and round. And then this other arrow, you look at that bone, it's jagged and rough. So that's bone loss. And you can see it in these x-rays down here too, how tall and skinny the teeth look. Right there, you see bone loss. You see bone loss there, bone loss there, bone loss. Generally speaking, will happen. It will start in one area where you have the swelling at, and then it'll work its way into other areas. And then here's some pictures of chronic periodontitis. You see the teeth look extra long, and that's generally when people tell that they have an issue. When there's less pink showing on their teeth and more white. Like if you see somebody smile, generally, you know, in our minds, yeah, I know nobody really thinks about this, but when you see somebody smile, if you see a good amount of pink and white, in our minds, we assume that this person has a nice smile and is healthy. It's because the proportions of gum to tooth ratio are correct. Based off of, you know, some of our social norms, you know, but there's the reason that it looks healthy is because there's the right amount of pink and the right amount of white. But sometimes you see people smile and they got all white. You barely see any pink. It doesn't look healthy. You know, people, that's generally when people will say, man, you know, there's something wrong with my teeth when it's not enough pink and a lot of white. And this is a situation where there's a lot more white than pink because the gums have receded and exposed the root surfaces of the teeth. And this is due to periodontitis. So you see, you know, these arrows are just pointing out where the gums have receded and exposed more of the tooth. And so this is just an example of ethnic pigmentation. This is what I was talking about earlier. These are healthy gums on the top. He's got some calculus build up in between the teeth on the bottom, but these gums, this isn't that pigmentation isn't an indication of health or not. It's just this individual is pigmented, is black. And it shows in our gums, but you do see some plaque and calculus. I know y'all remember this chart. I talked about this chart, the different stages of periodontal disease, and how you can move from mild to moderate to severe. Just some pictures of bone loss around implants and bone loss around the tooth. For people who have implants, you know, you have to really make sure that you go to your maintenance appointments with your dentist to maintain those implants, because if you don't, you're going to lose bone around them. And so I'm going through this quick because I have a little bit of a different topic I want to talk about today. This is just a little bit of a recap from last time. And if anybody has any questions, please stop me at any time. And so these are some of the
Scott,
yeah.
I got a quick question. When last time you were talking and when having this procedure, could you actually, you know, we the people kind of get kind of nervous about these type of procedures for its comfort. Could you actually admit somebody for this procedure where they'll feel more relaxed? Because a lot of times I know not to do it in there like for aftercare, you know, like having a surgery and you just stay in there a couple of days to get your mind together for what you experience. Because this type of stuff is some serious stuff. And to calm them down, say, you know, I can put you in could you do that? And with assurance allow you to do that.
Yeah. As a periodontist, that's what I am, a periodontist. And a periodontist, we treat patients with periodontal disease, but we're also surgeons. So we do all the surgical stuff, but we do, I could do it two ways. I can give you a pill to take, which is a anti-anxiety pill, or I can give you IV sedation. So typically patients who have a lot of anxiety when they come to the dentist, we can give you conscious sedation. Conscious sedation is basically you're still in control of your breathing, but we give you drugs to make you forget. And we also give you like a opiate like fentanyl. Everybody knows what fentanyl is. We give it IV and it takes away the pain. And then we give you a benzodiazepine, which helps with memory loss. So we manage the pain with the fentanyl, the benzodiazepine, and we also give local anesthetics, the numbing medication. So with those three things in combination, and we can give laughing gas too. So we can give like a little cocktail of different things. I can give you a pill the night before you come in, you take that pill 1 hour before you come in, and then you come in and then I get you comfortable. So it kind of knocks the edge off. And then I start an IV, and then I give you IV drugs, and it allows me to do the procedure. So by the time you wake up, we rolling you out the door. And now,
That's good to know.
yeah. Now the one thing about it is it doesn't work for every patient. It depends a lot about, what type of medical history you have. A lot of times, every time I do a sedation out, before I do it, I sit down with the patient and I hook up the heart monitors and I monitor their heart. I look at your heart rhythm and your heartbeat, and I identify the type of heartbeat and heart rhythm you have. I look at your blood sugar levels. I look at your hemoglobin levels, how much oxygen you taking in and out. We look at, of course, your blood pressure. So we look at a whole bunch of different parameters. We take your temperature to see if you're even healthy enough to get IV sedation. But if you are a candidate, it works really well for people with anxiety.
Okay, well that's good, because I know I would be one, but I'm good. I just, because I know that would show comfort people. And I had another question right quick. Can you go outside of the box and put a crown in for somebody? A crown? Could you have to stay in your specialty? The question was asked to me, could you do it?
Yeah. Now, depending on the state, but we do have some autonomy to do general dentistry. So yeah, I could do a crown. Now, I will say, for somebody who doesn't, that's not what I practice every day. So like, you wouldn't want to go to get a stomach surgery done by a cardiologist. So, even though the cardiologist probably could do it, but you kind of want to go with somebody who does it all the time, because if an issue arises, I'm not really equipped to handle that with a crown. So I would say, yeah, I could do it in an emergency situation, but I wouldn't be volunteering to do it, to be honest with you.
I understand perfect. Thank you. I got you.
All right. So these are just some of the different types of things that you might see in your mouth or somebody else's mouth. Just a lot of tartar, we call it, or calculus or plaque. You could also have a sore tongue. You can also have a bacterial infection on your tongue. You can have ulcerated sores, canker sores. Everybody knows about canker sores. And another thing I wanted to say while I'm thinking about it is, if you have, some people have different types of lesions that pop up in their mouth. No matter what type of lesion or sore you have in your mouth, if you have one, don't go to the dentist. Wait for it to go away before you go to the dentist. I have to turn away a lot of patients because they have all kind of issues, whether it's, different types of oral herpes lesions or canker sores or anything. If you go in to see your healthcare professional with an active lesion, the chances of spreading that to another part of your body or to the actual person who's treating you are really high. So if you do have a lesion, just wait for it to clear up before you come in to get treatment.
Dr. Scott? This just happened. I went to the VA and had got a little partial in the back on my molars, where what they spotted was, do you do anything with that bone, man? Because I got, the bone behind the teeth. What they call, it's a name?
Tori?
Yeah, the tori. And do you deal with that? Because they say that's some serious business when you're talking about shaving them down to even put partials on, even have work did. Because some people, the lady showed me some pictures, they're about that big. It's really serious business. Do you deal with that at all?
Yeah, I removed tori. And really, to tell you the truth, it's not really a big procedure. It's fairly straightforward. We just take an instrument, we open up the gums and just take an instrument and just cut the bone off and smooth it out. But that's basically what we do.
My understanding scared me to even talk about it. So I just told them to do what they had to do with that. I'd have had it for 61 years. Don't worry about it.
Yeah, a lot of times, we get patients who have had it for a long time, but they go to get partials or they go to get dentures. Their dentures won't fit over the tori
That's
sometimes.
what happened to
Sometimes
me.
it's so bad that they tongue, it affects your speech because it lifts your tongue up. Sometimes people snore and have all kind of breathing issues because they have those tori up under their tongue. So if you do have those types of issues, it's better to go ahead and get that removed and move forward. It's not really in the healing. Removing tori is not. I would say in about 2 to 3 weeks you'll be back to normal.
So I'm not throwing shade, but I did have some kids that was in the room with Byron on
you ain't got to bring that up.
on a trip that mentioned
Man.
how loud he snores. And so you think snoring has something to do with that?
No, hey, Doc, we're not gonna do that because there's a lot of people watching this, man. Let's move forward. I ain't gonna bother with that.
Yeah.
You know how it is. You snore little when you're in a hotel. It sounds worse than what it really is. Amen, brother. Echoes. You got it.
Because you're in that big space. That's the only reason they could hear you. And so these are just talking about different tongue conditions, sore gums. Some people suffer from TMJ pain. That's something that there are a lot of different treatments available for TMJ pain now. People use Botox a lot, steroids. They have all kind of plasma-rich fibrogen materials that they can inject. They take your blood and spin it down and then inject that plasma-rich fibrogen into the area, and it helps with some types of regeneration. So there's a lot of treatment available for TMJ pain. They even have laser treatments for TMJ pain. Just canker sore, sensitive teeth, just some home reminders what to do. Like I talked about last time, using Sensodyne toothpaste, for example, or Prevident toothpaste. Use it if you do have sensitive teeth. You could take a little bit of that sensitivity toothpaste and use it like a topical, and just rub it on the teeth where you have sensitivity at and let it sit on there, and it'll help a lot with sensitivity. But mainly you should be going to see your dentist if you have some sensitivity, because there's so many different treatments we could do to help you with sensitivity. And so the topic I wanted to really talk about today was what's important to you. You decide you need to go to the dental office, or you call in. It starts with you having some type of issue. And then a lot of times it takes a lot of courage for people to build up to call the dental office. Then you call the dental office, you get somebody on the phone, you have a lot of questions you want to get answered. And so I just took a minute and I asked around in my clinic, like, what are some of the common questions that people ask? And I wrote down a couple of questions that people ask all the time. And so hopefully if you see a question on here that you would like to get answered, let me know. Or if it jogs your memory and you have a question about something that I'm not mentioning, let me know also. So we going on my little sticky note over here on the left. The first question is, I get a lot, what is an implant? And are implants easier? Because a lot of times people come in, they want to know what an implant. An implant is just a screw, basically. It's a titanium screw that we screw down into your bone, and it holds the crown that you chew on.
For how long?
Forever.
How long does it last?
It lasts a lifetime if you take care of it. Now, implants are not easier though. Implants are more difficult to maintain than regular teeth, because a tooth has three things. It has a nerve, it has a lymphatic system, and it has a like sensory. And so if you lose, not sensory, blood supply. So you lose all of that with a tooth. When the tooth comes out, now you got this titanium screw in your jaw. It doesn't have any of those things. It don't have blood supply, all this stuff. So that implant relies on the bone that we that we drill it down into to hold it. Now, if you're not brushing your teeth and your gums become swollen like gingivitis, we call it peri-implant mucositis if you have an implant there. And what happens is, that inflammation causes bone loss. And when you have bone loss around the implant, it's a lot more severe than it is around a natural tooth. It can be. So, I always try to really educate patients on, if you do decide you want to get an implant, just realize that it's going to take a lot of home care to maintain it, but it's a really good option if you can take care of it. And so people always ask me too, should I get all my teeth taken out and get dentures? I tell people, no, you need to save as many teeth as you can. I don't care if you got 20 teeth that need to come out and you got 21 teeth in your mouth, save that one tooth. Save every possible tooth you can, because I see so many times, if you go on Instagram, you see people getting these dentures in a day or new smile makeovers in one day. They take all these people teeth out and put all these prostheses like dentures and stuff in people's mouth. And people don't need to be educated. It is very difficult to eat with a denture. If you get dentures, it is hard to eat with a denture. They flopping out your mouth. There's a lot of different foods that you can't eat. Or even if you get the dentures that snap on to the implants, a lot of times those cases fail because the patient isn't properly educated on how to take care of the implants. It's a whole regimen. You got to have a water pick, super floss, regular floss, dental toothpicks. You got to go to maintenance every month or two. It's a whole regimen that you have to do in order to successfully have those types of like dentures on top of implants, stuff like that. So I see a lot of those cases fail. And that's why, for that reason, I always tell people, save your teeth if you can. Is there a
So like
question?
with children, around what age is it, like if a child has to have a tooth taken out, an 8-year-old,
Mhm.
is that a permanent tooth, or is or will another one grow? If say if like
No.
one of their back teeth.
Now, for an 8-year-old child, the only permanent tooth they have in their mouth, typically, in some cases are different, is their first molars. You usually get your first big molars at 6. So, and a lot of parents don't know that, because a lot of people think, oh, it's just a mouthful of baby teeth, so who cares? They just gonna fall out because they big, the permanent teeth gonna come. And so people don't take care of them like they do their permanent teeth. But at 8 years old, children a lot of times have their molars and and they start to get their permanent front teeth. So they'll have their permanent front teeth and their first molars in their mouth at 8. Now, if you do have to take one of their permanent teeth out, the parents also need to know, and they also need to tell whoever's taking that tooth out, don't leave that space open. If you leave the space open, the child's teeth will drift into that open space. And if that happens, it will mess up their eruption of their rest of their teeth. So you need to, if a child loses a tooth like that, a lot of times what they'll do is they have devices that they'll put in the child's mouth to hold the space, because God gave them a certain amount of space, and the teeth hold positions. The baby teeth hold the space and allow for the adult teeth to develop in the jaw and erupt into those spaces. And so sometimes you see cases, some of us have teeth that erupted in the wrong places. Some people might have 3 teeth in one area, or have crowding, or different things. For a child, you should get braces. A child should get braces, but they should be going to see their pediatric dentist every 6 months. But to answer your question, if a tooth is taken out, a permanent tooth, they should put some type of device in there to hold that space, so the other teeth don't drift into that open space and cause problems for that child when they become an adult. And so another question people ask me all the time, are sores, I can barely read my own writing, are sores in my mouth contagious? I mentioned that earlier. Yeah, they're contagious. They are contagious. I had a patient that had ringworm, came to see me, had ringworm, She didn't even tell me. I noticed it on her arms, and when I looked in her mouth, she had ringworm on the inside of her mouth. This patient needs to be in quarantine. This patient shouldn't you and she, was coming to get treatment and she didn't know what to do, granted. But this patient should not be coming to see a dentist. You need to be quarantined with medication. So that's why I say if you have a sore, don't go to your dentist because they're not gonna. Some people, if they catch it, I know if I catch it, I won't treat. I'll tell you to come back once that sore kind of clears up. People always ask too, what type of toothpaste do I use? And my response is it varies. Some people need toothpaste because they have sensitive teeth. Some people can use regular toothpaste, tooth whitening toothpaste. Some people can't use toothpaste with tooth whitening in it because it causes sensitivity for them. Some people use all kind of combinations. People using baking soda and sodium and peroxide and all kind of stuff. Whatever keeps your teeth clean, use it. Whatever doesn't cause you any pain and is healthy and is good for you, use it. Because there's so many different options out here. And another question is, why should I buy mouthwash with alcohol? I tell patients all the time, it's okay to use mouthwash with alcohol unless it causes sensitivity. Sometimes people use the mouthwash with alcohol in it, and it changes the color of their cheeks and stuff. If you do notice a color change when you're using something like Listerine or something, just change to a non. They have plenty of different options in terms of mouthwashes. So just your body will tell you if something's wrong. So if you don't see anything wrong, then use it. Now
So
these next
a child. I'm sorry. I'm my mind's still back on the implant. So a child can get an implant, right?
No.
Or they can't. So
No.
if a molar is pulled on a child, that's just it.
Yep. And
Okay.
I think I mentioned this last time, Pastor, but African Americans, a child before they turn 18, typically lose 5 to 8 teeth before they turn 18. That's not including their wisdom teeth. That's permanent teeth that they lose to either caries, like to cavities, or they have a lot of young Black children have aggressive periodontitis, where there's specific bacteria that cause a hyperreaction in the child's body. They get it from their mother. They get this immune response from their parents. And what happens is there's a bacteria that forms in the mouth. It's a bad, it's a bad bacteria. We have some good bacteria, some bad. This is a bad one. And when it comes into your body and it kind of replicates and grows, your body mounts a response to it, but your body over responds. It causes a hyper response, and what that hyper response does is your body ends up attacking itself, and it causes rapid bone loss. So you see a lot. I have several young Black kids under 18 who are going to lose all their front teeth, upper and lower, because of it. And mainly the reason that they're going to lose it is not because they had the disease, the periodontal disease, but because it went untreated. And, you have to look at that diet. When I was a kid, I was running around drinking jungle juice. I was eating honey buns from the corner store, penny candies, all that kind of stuff as a kid. If you have that aggressive form of periodontitis and you drinking jungle juices and eating penny candy, you're going to lose teeth at a rapid rate. And we see that in our community with a lot of kids.
So what would you suggest as a church that I know, because we offer this, which is an extremely valuable resource, but there's probably a lot of people that won't take the time to look at it. There are going to be people in our communities that might not get this information. What can we do as a church as an additional step beyond what we're doing now to help promote this? Are there's I'm sure education is good and and I would imagine maybe the supplies, the stuff that they need to take better care. What would you suggest as a church that we could do to kind of help not only inform but equip our community so that children aren't losing teeth, black children aren't losing teeth at the level that you're speaking of?
I think really the only way to really combat it is to get the kid in to see somebody, because a parent is not going to be able to identify that. I could go out and show pictures, and bringing it to parents' attention is very important. But I found, a lot of times when I was treating children, talking to the parents is very difficult because there's a factor, you have to deal with embarrassment. The parent is embarrassed, or or defensiveness. So that's the issue. But I think, like, actually talking to the parent wouldn't be effective. The one thing I will say is getting those kids to see somebody. Now, I think one thing we could do a lot of times is there's a lot of programs. Like, there's a Mission of Mercy, which is a organization that I participate in. It's through the Florida Dental Association, and they have free events where people come out and get dental work. They get their dentures worked on. They get tooth extractions. I would start there. To see if they have. I don't know if they have an area where there's pediatric dentists there, but if there's a need, they'll fill it. So I think
Is it mobile? Do they come to the community, or do we have to get the community to go to them?
Yeah, they pick, like, this last time. This is my second year participating in it, and I probably should have. It would have been a good idea for me to tell you to put a flyer out, and I just thought about that. So the next event, I'll let you know, because there's one coming up, Pastor. But they had one in Tallahassee last year. So you would have had to have drive, going down to Tallahassee, and they had one this year in West Palm Beach area. And so I had to drive down there to participate. But there is a clinic coming up, and I'll make sure I get you the information, Pastor. It's on April 14th, I believe. It's either the 12th or the 14th, and it's going to be at Santa Fe College. It's called the Freedom Clinic. And the director of it is he's a UF doctor, and me and him have kind of began to work together. I go do some free clinics, and what I'll do is I'll put a flyer together and let you know all the dates that they have free clinics, because there is some paperwork. But what they'll do is they'll link you with some state funded benefits in terms of dental care. They'll link you with a dental counselor. So I think that would probably be a really good resource to get the child seen. But I need to make sure that they actually are seeing children. But I'll find out, and then I'll get you the information. So to answer your question, I think is just getting these kids to the dentist is probably the one and only way to stop it, or at least slow it down. And I think doing what we're doing now, and trying to make partnerships and create relationships, maybe getting the children's crest bus to come to the church. Maybe maybe we need to throw an oral health day out in the parking lot, and get Crest to come down. They have little buses, where mobile units where they treat kids and stuff like that. Maybe getting in contact with them, or things of that nature, I think will really help the children. But it's getting them seen by a dentist is what's most important.
Does I'm not sure if it's called Medicare, Medicaid, but I know people that have financial challenges. There's some either called Medicaid or Medicare that they use for health. Does that also cover dental?
It does.
Okay.
So children, as far as I know, I'm not familiar with Florida's policy, but I do know that every child has dental care.
Okay.
The states will cover a child for dental care. So a lot of the parents, and I think I might have mentioned that during our first meeting, that using those types of programs is underutilized. Even though there's over 200 dental clinics, across Florida, they're underutilized. You could take your kid up to one of these community health centers, and they can put in referrals. They can give recommendations. So there's plenty of dental clinics out in the community, not just the free clinics, but clinics that see patients, low income patients every day, and they send them to different clinics, or they'll send them to UF. UF has really good treatment for kids, and they take those types of insurances, the state insurances. I send my kids up there. I've sent my kids up there, so they get really good care. I think UF is a really good resource for a child trying to get seen. They see a lot of the kids in the community, so that's also a really good resource. And that was a good note, because I forgot about that. Yeah, they do use state-funded insurance programs like Medicaid. So you have any other questions, Pastor?
Not yet.
Pastor. Okay.
Not,
okay, good.
Not right now.
All right. So another question. Okay. So people also ask, this is from the front desk. I went up there and asked the front desk, what do people say when they call in? And people always ask, how much is the implant? An implant at the University of Florida is about $1,000 just for the implant. Now there's 3 pieces that come with an implant. You got the implant itself. You have another piece that fits down in the end, that screws down into the implant, that allows us to put a crown on there that you chew on. So all together for an implant and the tooth, it's about $2,500 at UF, which is about a third of the price that you would see if you went to in a private office somewhere. Typically in a community, people charge anywhere from $1,800 to $3,500 for an implant, just the implant. And then you got to pay separately for the crown. So getting treatment done at UF is really good. Another question people ask, how many appointments will it be? That's one thing I notice about patients when it comes to dentistry. Dentistry, they want it quick. When people think about dentistry, nobody likes coming in the first place anyway. So they want to get in and out, and they want the fastest treatment. And so sometimes what you would do, if you come in and communicate that to the front desk or to a dentist, sometimes you can get yourself in a situation where you get treatments that may not necessarily be the best thing for you, treat. And so if you come in, and I've had patients who really try to put pressure on you to move fast, but what patients don't understand is, a lot of these surgical procedures, it's hard for you to handle the post-op. After it's done, it's hard for your body to recover from a lot of these surgeries, especially if you need the surgery. That means you've had some kind of issue prior to needing the surgery. And so a lot of times these patients don't heal well. A lot of things can go wrong when you put pressure on your dentist to do procedures. And I always compare it to the medical doctor. When people go to the medical doctor, they'll sit out in the lobby for 2-3 hours and won't say nothing. A lot of times people will come to see me. If I'm 5 minutes late, the front desk is getting a phone call. Well, the patient is sitting out here, they waiting, or, I can't keep coming up here. How many appointments do I need to come for? Or how much is it going to cost? And I know it's mainly rooted in fear and, just not wanting to be there. And so, on the flip side, that whoever you're talking to needs to have a little bit of tact, and patience with you when they treat them. But try not to put doctors in that position, because some people will go ahead and treat you and do a whole bunch of stuff, and then you left with a product that you're not happy with, and it causes a lot more pain in the long run. That's what I always try to tell people. And then people always say, why can't we do everything in one visit? Same thing. You don't want to get, if you don't have any teeth in your mouth and you want to get dentures with that sit on top of implants, you do not want me to put 10 implants in your mouth in one day. You don't want me to do that. I could do it, but you don't want me to, because you're not going to be able to handle that. You're going to be in that chair for a long time. It causes all kind of health issues. You more susceptible to bacterial infections. If you have something like a diabetes, you could become hypoglycemic while you're sitting in there for so long, and pass out or have a medical emergency. It just puts too much stress on you to have too much surgery at one time. So I always tell people, take your time. Let's space it out where you're comfortable and I'm comfortable, and we get a good result, because that's what's most important. So did anybody have any other questions that they could think of, or topics that they want to talk about in the future, or just any comments about anything that I talked about today?
No, but I like the part when you're saying that you could do it, but it wouldn't be a good idea. It's almost like when somebody get I'm talking about a full like leg, just say a full leg tattoo. A real tattoo artist, he wouldn't do the whole thing in one day, because you can go into shock. That's too much for you. You got to keep coming back. You got to keep coming back so your body can gradually absorb and take it. It's the same thing with those type of procedures. Now that goes back to and play what I was telling you about when you have procedures like when I had surgery that came out, you got rehab. So what is your terminology for rehab to a major surgery that you would have to do? What would be your way of saying rehab for a dentist?
Post-op complications, or post-op instructions. I would prefer to give post-op instructions than deal with post-op complications. But sometimes we do have there are complications, or sometimes the patient may not understand what you're trying to tell them, and you can cause, you could have a secondary surgery because the first surgery didn't go right, because you didn't follow the post-op instructions, or we did too much and things went bad.
That's the point I was making when I first asked you about if it got to a point where that didn't work, could you actually admit them at that time and work out of the hospital? Can you know what I'm saying? That was what you just said. That kind of led to the question I was trying to present at first.
Now, a lot of times for typically the only and I have done some surgeries, very few surgeries in the hospital, done in a clinic.
I'm talking about follow-up.
Oral
What
surgeons typically work out of the hospital.
What I'm saying is sometimes home is dangerous for people. They need that extra gentle care. You know what I'm saying? They'll send you home and then you heard everything the dentist told you or the doctor told you, but when you get home, it seems like you can figure it out your way. You go back and do it your way and just screw everything up. There you go. That's what I was trying to say.
Yeah. Now, typically what I do, and I feel like every doctor should be doing this, anytime somebody do something to you, they should be calling to check on you. Typically I may not call that first day, but I'll call the second day. Or if it's a weekend, I'm going to call you on Saturday. I'll call you on Saturday. I'll call you Friday night. And in some cases, I'll even call the patient on Sunday as I'm going into the new week, because if they have some type of complication, I always leave space on my schedule to get them in immediately. You have to do that. You call, it's unacceptable for you to have gone somewhere and had a procedure done, to have had a surgery or anything done, and you can't get back in if something go wrong. It's unacceptable. And you should make sure that you hold these people who do procedures to you to a higher standard. Don't let them get away with it, because the standard of care is, if the patient is in pain, we do not turn away face and fracture, the base of their skull or something. It was an infection growing in their mouth, and they couldn't figure out why they kept having this infection in their mouth, but it was because they had a fractured bone in their skull. And so these are things but just imagine if I had put that lady off and didn't bring her in right away, what could have happened to her? And so, Philly. At least that's my opinion.
think it's extremely important to have a dentist that takes time to explain to you what's going on and you know what could happen if certain things aren't done, just to really kind of go overboard. Because I remember Michon and I had a we were with this dental this it seemed like a dental like a it seemed like a big corporation type thing. It was this
Uh-huh.
group of dentists, and we would go in there, and you know, and it seemed like every time I went there, you know, the option was to pull my teeth, and so after I got about three
Yeah.
or four teeth pulled, I'm like, something ain't right about this right here. I mean, I ain't got but so many teeth, and he's snatching everything out my mouth, and
Yeah.
and that was always like the first thing. Let's just pull it. Let's just pull it. And and I think I was with that dentist for probably about maybe 4 years or so. And then so Michon switched us, and we went to this other dentist that we're with now that we've been with for a really long time. And
Mm-hmm.
and when she saw, you know, when I first went to her, she told me, she was like, Mr. Rawls, um, you know what you're doing, all your teeth have a certain purpose, and because you don't have those teeth in the back, now you're causing your other teeth to do additional work, and so it's wearing them down, you know,
Mm-hmm.
because they're doing more work than they were supposed to do. And so you're going to have
Mm-hmm.
problems with those teeth if you don't get. We need to put some partials in your mouth so that you can begin stop putting all that extra work, you know, on your other teeth. Well, I'm thinking to myself,
Mm-hmm.
why didn't the other guy ever tell me anything like this? You know, why didn't it? So
Yeah.
he's allowing me to, you know, if what she's saying is true, he's allowing me to be in a situation to where I'm going to have to get my other teeth pulled.
Yeah.
And the fact that she took the time to share that with me, and she went ahead and got everything done, and got the first did like the little temporary things, and then had the real ones done, and everything has been fine. And so, you know, when I go and they do all their checks, you know, it's always a good report. But with the other one, it's like his response was just to pull teeth, but it seemed like I always had problems when he stuck the little thing down to measure, you know, the distance and things like
Mm-hmm.
that. I just always had issues. And now I've been with this lady. I think we probably been with her about 7 or 8 years, and all the issues that I used to have are gone because she's giving me instructions and telling me what to do. To whereas the other one, I think the issue would just end up just pulling all my teeth out, and I've never had to have any of the teeth pulled since I've been with her. And so I think it's
Mm-hmm.
really important to get a dentist that takes the time to explain to you, you know, what's going on.
Yeah. I agree. I think dentistry is a very creative field. I think that but you also, can get into situations like what you were talking about. You need to find somebody you mesh well with. Some people, that particular dentist, they might work well together depending on what issues they have. Then you go to somewhere else, like you said, and then all of a sudden, all your problems, you don't have any problems. They're more focused on just keeping you healthy and maintaining you where you're at and making small minor adjustments. And I think it also depends on the skill set. You need to be looking for individuals who are committed to education, people who, when you talk to them, they're knowledgeable, people who continue to get training, continue to learn, because dentistry, we're practicing. That's basically, no matter how many years of experience you come in, people come in with different things every time. It's never the same. So we never really master anything. We master techniques and philosophies and stuff like that. But the things that people come in with force us to always have to learn new things. And so you always need to make sure you with somebody who's committed to education. You can tell when you walk in their office, if their office is clean, is their staff, when you talk to their staff, is their staff knowledgeable? Is all the paperwork in order? When they come in, like you said, do they actually take time to talk to you? Because if you can take time to talk to somebody, you're exposing yourself basically and you are allowing this person to ask you questions. So if you're not as knowledgeable, you ain't gonna want nobody to ask you nothing. So you're gonna be in and out before somebody could even ask you a question. And so, those types of behaviors, if you see that, notice that in people, where they're kind of turned off by you asking questions, you probably should find somebody else. Or if you notice that they're always trying to take your teeth out, or every time you go there, there's always a problem, get a second opinion. And, more than likely, it might be just the style of that dentist, that you maybe didn't agree with their philosophies on treatment, and you need to find somebody who fits, more of your needs, who has a different philosophy, and like that one particular dentist, he might think, shoot, why would I have this patient spend all this money on fixing these teeth when it's cheaper to take them out? But the other dentist is saying, hey, let's save these teeth and add in some, let's fix a problem so you can save the teeth that you do have and move forward. It's two different philosophies, and you have to pick which one is better suited for you. But that's why I started off by saying, always, if you unsure, always err on the side of saving your teeth at all costs. I would not let a person just extract my teeth out. You cannot allow people, we that gets done to us. We go to a lot of these clinics, people don't care. They don't care about us. We deal with those types of issues across the board sometimes. And so you need to make sure that if you don't know nothing else, when you go to the dentist and they tell you need to get teeth taken out, you need to tell them that you need to save, I want to save this tooth. Within reason, but the first thing out your mouth should be, I want to save my teeth.
Good stuff.
And I
Good
think
stuff.
yeah. And so, if anybody has, Pastor Ross, I'll get you that information for the clinic schedule. They also do a free clinic in Marion County every Wednesday, I believe, and then they have a Freedom Clinic at UF. I mean, not at UF, at Santa Fe. I think they do it every couple months, but then every week there's UF dental students that go up to the Santa Fe clinic and they treat patients for free. So I'll get the information. I think that's how we can get it going, getting people to see dentists who, especially people who don't have the resources. That'd be really good for us, and I'll get the information to you so we can post it.
All right, Dr. Scott, I got one more before you get out of here. This fact of fiction. Like when you were saying somebody with one tooth and try to say that, I have heard, that's why I said fact of fiction. Do that one tooth give you the reason because I had a granddad had two of them. He would never do. And they say that they can still taste the food with those two teeth. Is that fact or fiction? That's all I got. Because I think it was the tongue, now what I was thinking about, but they said them same two teeth that'll give them, I guess, in their mind that they can still taste their food. What you say about it? Because they were cutting steaks and everything with them two teeth.
No, teeth, like Pastor Ross said, each tooth has a specific purpose. Some teeth can cut, some teeth tear, some teeth grind foods down. So, teeth can cut, but teeth have nerves in them that kind of give you, we call it proprioception, where you can kind of spatially in a space, you can tell, like when you close your mouth the same way, but when you bite down, you know where your tongue is, you know where your cheeks are, teeth have that in the nerve. Now, in terms of taste, your tongue has taste buds, different sets of taste buds that taste different, sweet, salty, savory, all these different tastes. Your tongue is responsible for that. So in unison, them working together on top of you breathing, breathing helps you taste too, because if you stop breathe, try this tonight, eat something and don't breathe while you eating it, you can't taste it.
No,
So
I'm good. I believe you. I don't want to do that and don't come back. I'm on the edge right now. I'm on the run, G. I can't do it, Doc. I ain't gonna bother with you, man. All right, that was fiction.
yeah. But if y'all have any other questions, let me know. Or if there is a specific topic, Pastor, you want me to talk about, I can do it. And I'll be gearing up for our next talk.
Right. All right. We'll see you next month. Same bat channel, same place. If you have an idea,
Yeah.
something that you want to have a conversation about, just inbox us, send us a private message, and I'll pass it on to Dr. Scott. But God bless you and thank everybody for coming out this weekend. We have our free food. Anybody needs help getting groceries to last for the make it to the end of the month? Saturday at 9 o'clock, come on by and get some groceries, drive-through format. And on Sunday we have Rep What You Rep. And so you can come to church and represent your organization, your profession, academic institution, whatever it is that you want to do. But Dr. Scott, thank you so much. And please share the post so that we can get this information out in our community. Have a great one.